environmental trauma will be finished up today, and orthopedic trauma, broken bones, so forth and so on. There are 25 questions from each of the 2 chapters. Starting with ortho. Bless you.
Thank you.
Everybody good? Ready? Recorders on? Starting with ortho. Definitely know the differences between the axial and appendicular skeletons. Axial and appendicular skeletons.
Sorry.
Remember in the worksheet as well as in the text, I had that chart on how much blood loss can be from a radius fracture, ulnar fracture, humerus fracture, blah, blah, blah. There is some, if you randomly get, there are questions specific to certain bones, how much blood loss there can be. So, different types of fractures, meaning the transverse, the oblique, the spiral fracture, comminuted, which means what? Many pieces, okay? And then open versus closed, and they will sometimes use the terms displaced versus non-displaced. Displaced meaning it's kind of angulated, non-displaced is everything is still in its normal position. Dislocations, right? Why are dislocations considered a urgent call? What is the complication from a dislocation? The big one that we're worried about.
Blood loss and nerve damage?
Not necessarily blood loss can be, but because it's not really broken ends cutting anything up, but definitely nerve damage can be a big issue. There were 6 P's to remember for assessing a musculoskeletal injury: pain, paresthesia, helichothermia, gosh, I can't think of that. But anyway,
PMS pain.
yeah, pulselessness, pressure, definitely review the 6 P's. What was the other one? Pale skin, powder. Let's remember to not get distracted or drawn into a grossly obvious orthopedic fracture. You know, that, oh my God, the bones are sticking out of his lower leg or whatever it is, might not be the life threat. So one of the big hazards with trauma patients is we tend to visually see something and forget to do our primary assessment. So let's not forget that. So you find an elbow fracture or an elbow dislocation or something like that, and there's good PMS. What would you do?
Splint it.
Splint in place. Okay.
Pull.
Regarding pain management for orthopedic trauma, what's our goal? Is it no pain or make it tolerable? You know, more than take the edge off, but it doesn't have to get to no pain. So review your procedures for splinting, like, you know, the bone above to the bone below, or joint above, joint below, checking PMS before and after. So they may ask about a local complication or a systemic complication from a fracture. Systemic meaning the entire body or somewhere else in the body, local meaning at the fracture site. So review potential complications of musculoskeletal trauma, both local and systemic. Absolutely go over compartment syndrome, what it is, how it happens, as well as crush injuries. And remember, crush injuries have to be a certain amount of time,
4 hours?
4 to 6 hours. They sometimes call it that smiling death, because when they relieve the crushing object, the pain's going away, but then they magically die. Why are they dying?
Potassium.
Potassium, which could be causing their heart to stop. Why else? All the muscles that were damaged
Rhabdo.
released, less specifically, released myoglobin, which plugged up the kidneys, which is a way of saying rhabdo, and your pH goes, acidosis goes down, right? So all those things happen from crush injuries. So if somebody fell from a roof or jumped out of a second or third floor window or somewhere high and landed on their feet, okay, do they need back weight?
Yes.
Right, because of the transfer of energies and everything else. Okay. Megan, I got this question on here specifically for you. I hope you get it. It asks about the anatomic snuff box.
Fresh on.
Right there. Yes. All right, the anatomic snuff box is which fracture, which bone?
Would be the radius, right?
No, radius is in your wrist. This is in your hand.
It doesn't, I don't know, or your thumb bone.
Your thumb bone.
The wrist,
It
where
starts
the
with an
thumb
S.
bone-
No. Here's where your radius ends. Your snuff box is here. What'd you say? Scaphoid. Yeah. Pelvic fractures. How much blood loss can there be?
20 to 30,000.
Okay. And if I was to say open book, not an open fracture, an open book, it literally means the pelvis, right, opened more as opposed to closed more, which is why in our assessment we push down, try to open it, and push in, try to close it. Can't believe I put that question on there, but I'll leave it on there. Asks about which of the following sets of injuries would most likely occur together. For example, am I gonna have a broken clavicle and a broken toe? Is that expected? Or, you know, a broken finger and a broken knee, or maybe a broken radius and a broken ulna? Like I said, I can't believe I put that question on there. What's the biggest hazard to an open, the most immediate hazard with an open fracture?
Blood loss.
Blood loss. Most immediate thing that's gonna kill him is gonna be blood loss. Infection is definitely a concern, but it's not the most immediate.
I'll send it to you.
Starting to get tired? Yeah. How do you reduce swelling and inflammation?
Rice.
The C for rice is,
Compression.
okay. The I for rice is.
Ice.
So there are some scenarios about whatever person in a car crash, motorcycle crash, slip and fall, blah, blah, blah. Vitals are whatever they are, injuries are whatever they are. So what is our goal for treating shock? What blood pressure?
80 to 90.
Okay. So, so if somebody had a pressure in the 80s and a heart rate in the 120s, would you say they're shocky?
Yeah.
Would you treat it?
No.
Okay. Treatment for compartment syndrome.
You don't know. Compartment syndrome is where, like, the pressure in there gets so high that it starts to, push
Cut off its own circulation.
Okay.
Yeah, the only treatment we can do, because we don't do fasciotomies, is try to get more fluids to push fluid in there. Give them IV fluids. Someone has a fracture, right? And suddenly afterwards they're getting difficulty breathing and a sharp pain in their chest.
Rib.
So they have a fracture somewhere.
No.
Could be my leg, my arm, whatever. But now all of a sudden I can't breathe and I have pain right there. What do you think it is?
Blood clot.
Yeah.
Pulmonary emboli
Hmm.
from the fracture. several questions on pelvic fractures. Osteoporosis is what?
Weakening of the bones.
And it is more common in
Menopausal women.
postmenopausal women. That's right. So there are multiple scenarios, I don't know how many you're gonna get, but multiple scenario questions about people who fall from a height and land on their feet. Like I've seen 3 of them already.
More than 20 feet.
What is a stress fracture?
Repeated injury, or from repeated injury, tiny little fractures.
Okay. So what is risk factors? Repetitive use, repetitive injury, what else?
Age.
Pain?
No, risk factor.
Age.
Like an like your. what
Like
kind
a
of
certain
person?
medical condition you would have.
Osteoporosis or,
Yes. Diabetes or other endocrine emergencies,
oh.
because it compromises circulation. Please know the difference between your clavicles and scapula. And remember, if you have an extremity injury, the best way to compare or to assess is to compare it to the
Other extremity.
other extremity, as far as shortening rotation, length, so forth. That's ortho. And now for environmental. Please review how your body does thermoregulation. Like if you get too hot, what does your body do? If you get too cold, what does your body do? What are the 4 different ways we can remove heat or add heat or something? Evaporation,
Conduction.
conduction,
Radiation.
radiation, and the one with wind. Convection. Right? So, like blowing on a hot piece of pizza would be
Convection.
convection, trying to cool it down. How does your body produce heat? How does your body conserve heat? Why are older people, geriatrics, at greater risk for heat problems, heat
Ability to
emergencies?
adapt to
Thinner skin.
temperature regulation, less bad. They're old. That's the answer I'm going with.
So heat stroke, there are 2 different types, classic and exertional. Please know who is more prone to get which. You know, like exertional, you would be exerting yourself, so that was probably gonna be your athletes or the military personnel or something. Where classic is probably more of your geriatric population, heat waves, things like that. So how could you differentiate a heat hyperthermic emergency, like heat stroke, heat exhaustion, everything, from a fever?
Patient presentation, have they been sick, or are you sick?
They don't know if they're sick, but
They have
Environment.
if I was having an environmental, like I've been exposed to the hot sun, heat exhaustion, heat stroke type thing, my body temperature's hot.
Just ask them what they've been
Are
doing.
they dry?
Would I get
The chill.
chills? Who gets the chills when they have a fever? People who are
Sick.
sick. So if the temperature is high, but they're getting the chills, is that an environmental problem? Definitely go over your different heat emergencies, like heat cramps, heat stroke, heat exhaustion, and heat syncope. So if somebody was, whatever, exercising, playing football, and now their body's all cramping up and everything, how would you treat it?
Remove them from the environment,
Okay,
give them fluids.
there you go. Do you have to have dry skin to have heat stroke? All I'm gonna say is make sure you read questions carefully, because I do remember this question, people have missed in the past, because I'm just gonna read this one part of it here without giving anything away in the question. Outside temperature is 37 degrees Fahrenheit. Or is it 37 degrees Celsius? 37 Fahrenheit is what?
Cold,
Very cold. 37 Celsius?
hot.
It's 98 degrees Fahrenheit. You know, it's very hot, so people just make sure you read RTFQ squared. There's a couple of, oh, this one's a good one. So, they're not dead until they're
Warm and dead.
warm and dead. So that hypothermic cardiac arrest, hypothermia is one of your H's and T's. How do we work them?
Warm and
Follow
warm.
ACLS, warm them up, right? But just remember that defibrillation, right, is only going to work if their body's relatively warm. So let's do one shock, but we may refrain from future shocks until body temperature comes up a little bit.
So if you have that hypothermic person, you put the pads on, you do that first shot,
Mhm.
you throw a blanket on top of them, is that gonna affect the
No.
pads at all?
Nope, not at all. Different types of frostbite, superficial and deep. And how do we treat frostbite? When do we thaw, when do we not thaw type thing? How do we do the rewarming process? What is the definition of hypothermia, specifically the temperature?
95 and under?
95 and below. Why does alcohol make you more predisposed to getting hypothermia?
Viscosity of your blood. Right.
Okay, that could
Increased
be.
ability to feel that you're cold.
It decreases your ability to shiver. It dulls your nervous system, so it doesn't know to send a signal to shiver. How does liver disease predispose somebody to hypothermia? Lack of,
Glycogen?
bingo, no sugar reserves to burn up to sugar. Remember, burning sugar is going to make heat. If I don't have reserves. So alcohol and liver disease, not good. So if they were trauma patients and they were hypothermic, what happens? What was that trauma
Triangle.
triangle? Yeah,
Hypothermia, decreased coagulation.
and acidosis. And hypothermia actually causes decreased coagulation. What is cold diuresis?
Makes you pee a lot when you're cold and shivering.
It's exactly what it is. Your body's cold, so it shunts the blood to your core, but the kidney interprets that as excess blood flow, so it makes more urine, trying to get rid of extra fluid.
They also try to pee out the sugar.
Yes, but that's not what the cold diuresis is. It's because the cold temperature, you shunt the blood to your core, but your kidneys think it's extra fluid, so it tries to filter it out. Stupid kidneys, yes.
Just one.
water rescue, drownings. What are some ECG changes we see with hypothermia?
J-point,
What wave is that? Osborne wave or J wave? Okay. There are a couple questions on drowning victims using like PEEP or BBM or cardiac, when to start CPR or when do you start rescue breathing? Before you pull them out of the water, like, if possible. Can't really do compressions in the water. There's about 5 questions on here about drowning. A couple scuba diving emergencies. Right after surfacing, they get sudden chest pain. What most likely is it? Barotrauma or
Depends.
alveola burst. That, I don't remember what it's called though.
gas embolism. Under a bubble. Yeah. If it happens like immediately after surfing, within a couple minutes, it's a gas embolism. If it happens 30, 40 minutes, it's probably more of the bends or something like that. Gas emboli is usually within a minute or 2, maybe up to 5. What is decompression sickness?
Coming up too fast.
And nitrogen does what?
Goes into the wrong tissues.
Yeah, it bubbles out. So we talked about that. So as far as when symptoms begin for a diving, as in scuba diving, related emergency, what is the most important? Try to figure out when they began or what the diver was doing when they began. Did it happen while you were going down, or did it happen while you were coming up? So if a scuba diver comes up and immediately goes unconscious, what most likely is it?
Depends.
Then it takes 20, 30 minutes.
The emboli.
Air emboli. Anything immediate is going to be the air emboli. Think of a pulmonary emboli or something like that, or a stroke. It happens. Also, oh, I got this pain in my chest. I can't, so anything like that, it would be immediate.
So the nitrogen, of course.
The bubble,
down,
yeah,
the emboli, or the bend going up, and then that last 10 feet, what you're talking about is the emboli.
most likely.
Most likely, okay.
What is shallow water blackout? When you black out in shallow water, yes. Who gets it? Person who
Free dive.
hyperventilates right before they get in the water. Like I'm gonna breathe real fast, so I can hold my breath longer. That's shallow water blackout. That typically happens in swimming pools. How do you protect yourself from lightning?
Stay inside.
Don't just drop. Stay up. Don't be the tallest thing around. Stay away from Ken. Either one of those. Different types of spider bites. Black widows, brown recluse. Well, black widows, brown recluse. We'll leave those out. Actually, with black widows, remember it's really only the female black widow that is the deadly one. Male black widows can't hurt you. So they're a lot smaller. So just remember, what's her name from X-Men? The actress. Scarlett Johansson, the Black Widow. Females can hurt you. What does the venom from a snake bite do? Specifically, pit vipers do.
Isn't that coagulate?
Yes. clots your blood. So if somebody was bitten by a pit viper, rattlesnake, whatever, on their leg, what would you do?
You split it,
Don't
Level.
move it.
Or lower than
Yeah.
more.
So
And-
what?
Don't move.
So do you want them walking?
No.
No. So like that. Mobilize it, keep it lower than the heart, and don't use it. 4 different ways you can transfer heat. Kind of mentioned earlier, radiation, evaporation, conduction, convection. One of those. So what would make evaporation not work?
Humidity.
Yeah, very humid, like Florida. Heat stroke, right? What are the 2 things needed to diagnose heat stroke? Elevated body temp and
Altered mental status?
altered mental status.
And
how can you estimate the amount of pressure a scuba diver was exposed to?
How deep you went.
How deep they went. And if you really want to remember it, every 33 feet is double, is another atmosphere. So 33 feet were 2 atmospheres of pressure, because at sea level you're at 1. At 66 you're at 3, at 99 you're at 4. What is POPS? Pulmonary overpressurization syndrome. I know you 2 know, we just did this. Okay, so when the lung pops. High altitude pulmonary edema and high altitude cerebral edema. Just review those and treatments for them. And because black widow spider bites can be very painful and you may get muscle spasming, what might you do to treat the muscle spasms?
Benzo?
Probably benzo. And what is Hymenoptera?
Scorpions?
Nope.
Oh, no, wait, bees and stuff.
Bees and stuff, bees, spider ants, blah, blah, blah. And what is usually the cause of death from Hymenoptera?
Anaphylactic.
You guys want to know. Very good. Thing on this test.
That's it.
Remember, we're not here until Wednesday, and